and hopefully people will continue in their own way to continue to keep our city in mind. Let me give you the number for today. We have the Houston Health Department is reporting 615 new cases of COVID-19, bringing the total case count in the city of Houston to 1,995. The total number of deaths has increased by 2, and that number is now 14. And with regards to these 2 who have passed in our city, died in our city, one is a white male in his 80s who passed away on March 27th, and a Hispanic female in her 70s who died on April the 2nd. Both had underlying health conditions. So the increase in COVID-19 cases, let me just say, so that brings our number to 14. And for those, in terms of the ethnic breakdown, that of the 14 for blacks is roughly 57%. For, let me do this. For blacks, it's 57.1%. For white, it's 21.4%. And for Hispanic Latino, that percentage is 21.4%. And then we are continuing to work to break down even more the other cases, the 1,900 who have tested positively for COVID-19. Now, the increase to 615, just like on Monday, when we reported 402, that went back to mid-March. The increase in COVID-19 cases that's been reported today, the 615, is due to a large volumes of reports being received electronically from LabCorp, Memorial Hermann, and Quest. Half of the testing numbers are from March, and the others from April. So of that 615, half will be coming from March, and half will be coming from April. Nonetheless, we're adding 615 to the total count, and that brings that number up to roughly to 1,995. In terms of overall demographics, I've covered that already. And because of the increased number that's taken place, I'm going to make a change to underscore the importance of social distancing. I've notified Steve Wright and others that we are going to be closing down our parks and our trails for this weekend. And that's to underscore the importance. I said before at the beginning of this week that April was going to be a very important month for us, and it's very, very important as we move forward in the month of April that we engage in social distancing where possible, stay home, go to the grocery store, whatever you do, social distancing is so important. And so in order to reinforce that, in view of the number that came out today, the 615, I've already notified that as of this evening, the parks and our trails are going to be closed for the weekend. Now let me stop at this point, and let me bring up Dr. Peirce.
Thank you, Mayor. So 615 is a large number, but as the Mayor pointed out, they extend back over quite a period of time. If you imagine the graph that we've looked at of what we call our epi curve, it's got a bit of a sawtooth pattern to it because of these bursts of numbers that we're seeing. What we need to look at is the overall slope of the graph and not these jagged edges that it has. It is frustrating for all of us to see these numbers behave this way, but this is a function of the delay in the reporting. And there's not necessarily a bad actor here. Some labs are just taking longer to get the results, and then sometimes they cohort it before they report it to us. The law in Texas is they're supposed to report the positives to us immediately. And then when they do, sometimes we then have to go through, and especially in days like today when we get this large number, we have to go through each and every one of those and make sure that they're all in fact Houstonians, and we have to find out those that live in other jurisdictions and get that information to those jurisdictions before we can report it. So there's even a little bit of a lag. Now that lag internally here within the City Health Department is generally no more than 1 day, but it does illustrate the challenge that we have. Again, we're reporting 2 deaths. today, and the whole point of this is to prevent deaths. And so this is a city of 2.3 million people. The total number of deaths is 14. We need to continue to strive to keep that number down. The mayor is taking another step today to be aggressive. We have talked to the mayor many times that in public health, when it comes to epidemics and pandemics, if you're going to take steps, you need to be aggressive, and you need to do it early. And this is exactly what he has been doing. And that is verified by the fact that at this point, we have 14 deaths, and not 140, not 400 deaths. And the Kinder Institute report that came out that the mayor talked about just in the last day or so, illustrated how many more deaths there would have been had we not, or had he not, and the judge had not taken those aggressive steps. Nevertheless, the deaths that we have seen are tragic, and that all of us as Houstonians need to continue doing what we're doing and recognize this is a battle, and every one of us is a soldier in that battle. Thank you, sir.
And let me just say, I've asked them to put the more detailed information of the 14 who have passed. Even though there's no name, each one of them has a name. Each one of them comes from a family. Each one of these families' lives have been changed, and the city as a whole has been impacted by their loss. And so there are 14, as you can see, and you can see their ages. Most of them 60 through 70. In one case, you have in that 40 to 50 range, and the youngest you have in that 30 to 40, which we reported on just the other day. And so that's 14. We want to keep the death toll as low as possible. When you consider the fact that over 15,000 people in the United States have lost their lives to COVID-19, in the city of Houston, that number is 14. And every day we want to work to keep it low. And at the same time, we want to work to bring down the number of people who test positively for COVID-19. And so we expect that number to continue to rise as more testing take place. And let me just say, we need more testing, because that will give us some indication again of the degree of community spread that exists in our city. But in the meantime, it's the social distancing that's going to be very, very important. It is working. I want to thank people for what they are doing, but we need to continue to do even more. What I can say, things will go up and go down. The number of people, for example, that was on a ventilator due to COVID-19, based on numbers that I've seen, is less today than yesterday. The number of non-COVID persons on ventilators, that number has gone up. So there's fluctuation. But the numbers are still within our hospital ability to handle, and that is the key. That's just by slowing the progression such that our health care delivery system can handle these cases within their capability. So irrespective of the number of people who have tested positively, from March to where we are today, we're still within the ability, the baseline ability of our hospitals to handle the system. Now let me bring up Chief Pena.
Thank you, Mayor. Good afternoon. So today marks roughly about a month since we started this operation in earnest. And before I begin my report, I want to take this opportunity to publicly thank our firefighters and paramedics for the incredible work they've been doing through these very, very difficult times and austere conditions. I can't say enough about the good work that they've been doing. That goes as well for our police officers, our doctors, our nurses, our grocery store workers. They've been doing an outstanding job, and they deserve a public recognition on that. As far as my report goes, I'm happy to report that we've had very little change, and in these times, that's a positive. We've actually had 3 less firefighters in quarantine from yesterday, and that's a trend I'd like to continue. 3-4 days ago, we were up about 220 firefighters in quarantine. Yesterday, we were down to 155. Today, we're about 149 or so. The other good news is that our firefighter who was hospitalized, he's still in ICU, but he is making progress in the right direction. He's feeling better. He is not intubated. He's on oxygen, but he's moving in the right direction, and we hope and we pray for a full recovery. In regards to the stay-home enforcement, we had 101 reports from the public for businesses that remained open. We haven't issued any citations in the last 24 hours, in the last 48 hours actually, and we've received voluntary compliance from all the business owners, which we're very thankful for. The goal again remains to be is education and voluntary compliance. So we're happy to report that the public is doing the right thing as we ask, and we're hoping to get through this sooner than later. Thank you, Mayor.
Chief Osalator.
Good afternoon, everybody. Thank you, Mayor. Thank you for the day of prayer today. I mean, it means a lot to everyone in this community, and I think as a community of many faiths, it set a great tone for Passover, and happy Passover and Easter for everyone that's coming up. I'm going to start off with the, this is not easy to do with your glasses, with an update on our operation in terms of our personnel. We have 120, as of today, 120 personnel that are quarantined. 88 are sworn classified, 32 civilian personnel. We've had a total of 141 personnel tested for COVID-19, 137 sworn, and out of the 137 sworn, we now have 31 positive, so that's gone up by 4 since yesterday, 55 negative, and 51 pending. Civilians remain at 4 tested, 1 negative, 3 pending. Again, 5 have returned to work since they were tested positive, which is a good sign. And today I've been talking daily with the family of our officer, our detective that has been hospitalized and remains in critical condition. And in light of the day of prayer, Mayor, they've asked me to just ask the community to pray for him, and I'm able to identify him at their request now. His name is Ramon Cervantes. Ramon is, we call him Ray, and he actually is a homicide cold case detective. Has been around for quite a few years. He's 57 years of age. He remains in critical condition on a ventilator, and his wife Liz and the family have asked that, first of all, they want to say thank you for all the prayers, because they believe he went from a really grave condition to critical condition. And there's been some slight improvement. So they would ask that the community continue to pray for him and for the whole family, because Liz is also positive for COVID now. She's come back positive, and she's in isolation in her home. So please, 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 thank you for the continued prayers, and please continue to pray for Ramon Cervantes, Ray, and Liz Cervantes, the entire Cervantes family, and everyone that's being impacted by this horrible virus. I think it's important to note that if you think about the fact that we have this big city, we've had 38 police officers nationwide as of yesterday that have died from COVID-19. So I think it really speaks volumes as to a city this size. There are only 800,000 police officers, and 38 have passed away, not to mention the support personnel in New York City that have passed away. That we have such low numbers, Mayor, I think is a testament to the steps that we've taken here in the city and that you've taken with the health department. Our call load continues to be lower than normal. We have a 4% decrease in call load since this operation started. The 2 areas that we want to continue to discuss with the community and make you aware of is the area of aggravated assaults that are up 8% post-COVID, stay-at-home orders, and the burglary of buildings. Again, those are up by 21%. I will say that we've been very deliberative and very thoughtful and very intentional in terms of the way our decisions when we go to make arrests to try to keep the jail population down, to try to help out Ed Gonzalez and the Sheriff's Department. Our arrests are actually down, and I think that speaks of 2 things. One, it speaks as to the fact that the people of Houston, when the going gets tough, Houstonians come together, and they know how important it is for us to all try to be good partners, good neighbors, and good members of the community. So just so you all know, our arrests right now are down post-COVID 47%. That doesn't mean crime's not happening, but it's consistent with the fact that calls for service are down, and everyone seems to be doing what their part, a lot of the folks. So we're 100% operational. To the families out there with the domestic violence issue, just remember that if you call us, we will be there. We're operating on all 8 cylinders, And to the children that might be in situations, again, where they may be facing an abusive situation at home, please call us. We will come and we will protect you. So with that, that's my report for now, Mayor.
One thing I do want to underscore, if you look at this, everybody on this list suffer from underlying health conditions. I want to emphasize that, to emphasize the importance of people putting on their face coverings. You may be fine. You may not have an underlying condition, but you may be coming around or going around people with underlying conditions, people with hypertension, people with diabetes or other ailments. And so it's important to protect them from you, especially if you're asymptomatic and you're carrying something. So please, the face coverings, as I drive around the city of Houston, I'm still noticing that there are people in our city, in neighborhoods, communities, that are not putting on the face coverings. Let me encourage you to do that. Also, let me just encourage you to, again, to engage in social distancing. Let me call on Director Steve Wright from the Parks.
Thank you, Mayor. The mayor made a phone call to me approximately about 1:45 this afternoon to discuss this decision. Obviously, Parks and Rec Department support the mayor 100% behind this. 15 minutes later, we had a group phone call with all the management leadership team at Parks and Rec to pivot very quickly. 100% supportive of this. So out of our 380 parks, we have the ability to lock up 100 of them with gates. That will begin at sundown this evening. We've also started allocating any barricades or different ways that we can discourage people from going to these parks. The other thing that we're going to do, we're going to continue with the urban park rangers. We have a staff of 36. They will continue rotations throughout the weekend. If you take 380 parks and 36 urban park rangers, that's about 10 parks per urban park rangers. Obviously, we've been working very closely with the chief and the police department to help with enforcement. So the urban park rangers have a direct line to Houston Police Department. We've worked with this mayor long enough. When the mayor says we're locking down and shutting down parks, end of the day today, he means we're locking down and shutting down parks through the weekend. So we will be patrolling them. We will be shutting them down. We ask for everybody's help. This is a very serious issue. The mayor did not come to this decision lightly, but the mayor is once again taking a higher look at the greater good on this. So we've pivoted very quickly. We've allocated and reassigned resources very quickly, and we will continue working through this together. Thank you very much.
And at the same time as we're dealing with COVID-19, we have to understand that the Mother Nature doesn't necessarily stop because we're dealing with the virus. And so we are anticipating a fairly amount of rainfall later on this evening. And so it is good at this point to also say be weather aware. And so let me bring up Chief Bunick to speak on that level.
Great. Thank you, Mayor, for your leadership and your guidance during this crisis, including taking the additional steps like temporarily closing the parks to slow down the spread. Before I talk about the weather, I want to mention PPE. I'd also like to publicly thank all the generous people that donated to yesterday's PPE drive at Minute Maid Park, and also to the folks that are helping us coordinate. That's the Office of Business Opportunity, Interim Director Marcia Murray, LaQuinta Norma, and then Jackie Miller out of the Mayor's Office of Public Safety. We appreciate their efforts. Donations, if you're unable to do it yesterday or this week, can still be made at donations@houstonoem.org. That's you can email us, donations@houstonoem.org, and we'll make arrangements for a pickup or delivery. The Office of Emergency Management has been in close contact with the National Weather Service, monitoring the storm that's coming into the area. We anticipate severe thunderstorms, high winds, possibly large hail, and then some street flooding. Estimates of rainfall go anywhere from 1 to 2 inches in some area to 2 to 4 inches in isolated area, which would cause some minor street floodings. We think that all the bayous and creeks have capacity to handle the rainfall that's coming our way. But, you know, we want to remind people to stay off the streets, stay home tonight if you can. It looks like it's going to be a short window. It's a fast-moving storm. probably between 8 p.m. and 11 p.m. Right now, the storm's in Austin, and it's approaching College Station. It's moving at a rapid pace, which is good for us. OEM has also been in contact with HPD, HFD, and Public Works. The three of these departments have personnel and equipment on standby and are ready to deploy it if needed. I'd encourage everybody to sign up for alerthouston.org for emergency messaging, and I guess that's it. Thank you, Mayor.
Okay, so we're expecting some rain later on this evening, and possibly even through on and off Friday as well as on Saturday. But you're already staying at home anyway, so that's good news. So we are ready to deal with things on multiple fronts, and so we really appreciate everyone's cooperation. Having said that, we'll take any questions anyone may have.
This is a two-pronged question. So with respect to your decision to close the parks this evening at sundown, could you clarify why you decided to take this action?
Got the numbers at 1:30 this afternoon. 6:15 is our largest jump. And we've never gotten that. The largest number we got was on Monday with 402 new cases. But even that went back from mid-March to today. Mid-March to April. And then when the health department sent me the numbers today at 1:30, I saw 6:15. That's a high jump. And so to underscore the importance of social distancing, I decided to take the additional step and to say we're simply going to close the parks and our trails down for the weekend.
And you have the ability to lock and key 100 of the 380 parks, I believe is what you said. So if folks disobey and they're caught at city parks over the weekend, what's the penalty going to be? Are people going to be arrested or issued citations?
Well, let's just hope that they're not going to do it. We're going to close them down, and the park rangers and police will be patrolling the various areas. One thing I know is that when we ask the overwhelming majority of folk, when we say don't do it, they don't do it. It was my desire to keep them open. Certainly wanted to do that because we wanted to provide people some relief outside of their homes. But the reality is that 6:15 was a number that was higher than it has been, and I've always said that April was our month to really mitigate against the rise of this virus. And so with that being 16, if the number come much, much lower, like yesterday, the number was 60. But today is 6:15.
But do you envision people being arrested or just issued a fine if they're caught?
Well, if they are in the parks and we're saying not to, then I leave it up to the police department to take the necessary steps. Okay? Yes, sir.
The larger parks like Herman and Memorial Park, which obviously you can't gate, is there a plan to do barricades over the streets that take you into the park, or is it going to be more of the honor system for the public?
No, the park rangers will be out there. Steve, you want to address that?
As a matter of fact, we've got a variety of park partners that help us with the operations of the larger parks, such as Herman and Memorial. They've already got plans in place as well. Once again, we'll begin with closing off all the parking lots themselves. There are certain areas that you can actually close off either with barricades. Some of them do have gates as well, cones, things like that. So they've already got a plan in place. They've literally activated it at 2:05 as soon as we made the phone call to them. And then the areas that we can't actually barricade will take some patrol. That's the reason we've got the urban park rangers out there. They will be patrolling the parks and going throughout the parks. Obviously, as they come up to these different groups and let them know, so far we haven't had that many confrontational issues. And once again, once this has been announced and mandated by the mayor, we'll approach these people, let them know that the park is closed. And if an issue does escalate, we've got the full support of the police department.
As far as the users of the park, they're going to be allowed to do their normal things this evening up till sundown, or how is that going to work, the timing?
We will start closing the parks down at sundown this evening. It'll take a while to get them all actually done and completely closed off, but the normal activity is to open them up at sunrise and close at sunset anyway.
Can I add something to that, Mayor, real quick? And just so you all know, we have already, we had already, before the mayor made this decision, designated mounted bicycle units, officers in specialized vehicles to patrol parks for the social distancing over the weekend, and now they'll move from patrolling for social distancing to actually patrolling to make sure people stay out of the park. Our enforcement posture is, if we get compliance with the warning, we will go to compliance, but if we come back 30 minutes later and you're there again, then you're showing that you're not really complying, and that's when you'll probably receive a citation. And then if you refuse to leave, obviously you are subject to arrest for not leaving. But we prefer to use sugar than vinegar, and hopefully we won't have to use too much sugar or too much vinegar, because of the weather that's coming, we'd rather people stay home in the first place.
And Chief, since you're up there already, can you talk a little bit more about Officer Cervantes? You know, like yesterday, for example, the Sheriff's Department had a prayer for their deputy who's in critical condition. Do you have any idea how he got, was a community spread, and then just how the family and the department's dealt with?
You know, we've been dealing with it by dealing with the family every day, talking to the family, keeping in close touch with the family. Obviously, we've been having prayer circles for him. Our chaplains have been praying for him, but no one's been praying for him by name. The family initially, Liz wanted privacy, but now when she saw that we were getting those prayers, and now at the weekend and Passover and Good Friday and Easter, she reached out and said, I'm ready. We really need prayers, because he did show a slight improvement, but he's still critical. And so now she really is asking for the community to continue to pray for Ray by name. Again, his name is Ramon Cervantes and Liz Cervantes, but he goes by Ray. Great guy, real passionate guy, and does some phenomenal work at our cold case unit. So we really need the prayers. And we've been very quiet about it, because you always want to respect the family's wishes, and under HIPAA laws, you kind of have to when they don't want you to use a name. But they're ready for some prayers, and again, it's the Cervantes family. Thank you.
And Dr. Peirce, can you talk to us, just clarify for us, where are you thinking the peak, or where does the healthcare providers and the experts in this thinking? Is it still like May 3rd? I mean, you have 600 cases today, but like, where are you thinking of the peak, the valley, or?
And so, those that do these projections, they're refining them weekly, generally, the ones that we're talking to. And so the peaks, depending on, everybody's got a slightly different peak, but it looks like near the end of April, beginning of May. And so the numbers that we're seeing continue on the trajectory for the peak being around that time. So the projections aren't deviating a whole lot. They waver back and forth a little bit. But an important thing for everyone to understand is that those projections are based on the assumption that everyone continues to social distance, wear their mask, wash their hands, that the community continues, as the mayor is leading us in, doing those things that we have to do, those things that mayors can do to encourage, if not enforce, the behavior changes that we have to have. And so those projections can change if people don't continue to do what they're doing. And quite honestly, with the jump today, it tells us we need to do a better job of what we're doing as individuals. We need to do a better job. So again, the jump in today is a little bit of a backlog, but as I said earlier, you need to look at the overall slope of the curve, and it is continuing on the track that we have expected it to. And the only way for that to change is for us to change our behavior and to do what the mayor says. That's what will change the curve of that slope.
Anything else?
Chief Acevedo, para la comunidad latina, para Berea Visión, necesitamos saber de la cancelación de la que van a cerrar los parques. ¿Nos puede dar un detalle, por favor?
Sí, el alcalde ha dado orden de que vamos a cerrar los parques de la ciudad, porque desgraciadamente lo que ocurrió es que hoy, en las últimas 24 horas, más de 600 personas salieron positivos para el virus. Así que empezando esta tarde, los parques que ya se pueden cerrar con reja, lo van a cerrar cuando faje el sol, pero van a estar cerrados todos los parques, más de 300, de la medianoche esta noche hasta el lunes por la mañana. Así que si lo ven en el parque pueden tener multa o pueden ir presos si no hace caso. Por el fin del día, con la tormenta que está llegada esta noche y más tormentas este fin de semana, debemos quedarlo en la casa de todas maneras. Pero eso es para la protección de la comunidad. Nosotros vamos a estar patrullando, nuestros colegas del Departamento del Parks y Recreación van a estar patrullando y pues, no queremos tener que tomar el enforzamiento, pero si tenemos que hacerlo, lo vamos a hacer.
Muchas gracias.
De nada.
Okay, so let me just say in closing, of the 1,995 cases that we have, most of the people are recuperating at home and not in the hospital. The overwhelming majority are recuperating at home. In terms of where we are, people who have passed, that number is now 14. When you compare it to the rest of the country, that total number, it's a very small number of that number. But we want to do everything we can to keep that number as low as possible. We still anticipate cases continuing to rise until we reach our peak. Some say the end of April, the beginning of May, whatever it is, social distancing is very, very important. So please, please stay at home or wherever you go, just make sure you're 6 feet apart, and engage in social distancing. That one, I'll have to think about that one. I don't know the answer to that. What have we done? All of the city-owned golf courses have already been closed, with the exception of Gus, but that's not city-operated, correct?
It's not city-operated, city-owned, but not city-operated.
Yeah, with the exception of Gus Wortham, all the city golf courses are already closed.
Mayor, with the projection of the peak being sometime in late April, early May, are you looking at possibly extending the stay home, work safe order? Have those discussions taken place yet? Are they going to take place yet with county leaders?
We'll continue to look at, and see where we are going. I don't rule anything out. Let me just put it that way. We don't rule anything out. The goal is to stay focused as much as possible. I would love to see us, by engaging in social distancing, washing our hands, using sanitizer, putting on these masks, that we snuff this thing out as much as possible in the month of April. That's my prayer. Okay, that's my prayer. And then we'll just take it day by day. And we'll make decisions based on the facts, the science, and the medical professionals. So just like, for example, I would have loved to have kept the parks open as much as possible. But when the fact came in today at 1:30 and the number was 615, then that changed my calculus. It's one thing, yesterday the number was 60, the day before it was 175, today it was 615. And so, I just can't blindly ignore, disregard the number. It's 615, it's the highest number that we've had, even though it's, you have 3 labs that are reporting electronically, and half of the cases are coming from March and half coming from April. It is what it is. And so to underscore the importance, and you make the adjustments based on what's presented, and we'll make the adjustments, and we're saying shut it down in terms of the parks and the trails. And my hope is that we'll get to the point where the number of positive cases are going down, and then the number of deaths, we won't have that number. When we get to that point, I'll feel real good. Today, we've got reporting 2 cases. I think this is the first time in the city of Houston that we have reported 2 cases on the same day. We have one time before. So it's either been 1 or 2. That number is very, very low. So we'll continue to look, and based on what we see, based on the medical advice that we're given, based on the facts and the science, we'll decide what the next policy decision will be. I know people are getting real antsy about being at home. I know that. I understand that. But let me just ask people to be patient and to stay the course, so we can get through this. Okay? Thank you all so very, very much.
All right, Mayor Turner, they're looking at the numbers this afternoon. 615 new COVID-19 cases in the city of Houston, and he says he made the immediate decision to close all 380 city parks through Easter weekend. That'll be starting at sundown. You'll see the gates close at parks that have gates and barricades going up at others, closing them down following the county's lead in this case, and keeping people out of parks on this holiday weekend. The other news coming out of this press conference today came from the police chief, Art Acevedo. Today, he revealed the name of his detective who is in ICU. He's been talking about him, giving us updates each day, but today, with the permission of his family, we know that his name is Ramon Cervantes, 57 years old, a homicide cold case detective with HPD. And on this day of prayer, the chief asking everyone watching to provide a prayer for that detective who is currently in critical condition fighting COVID-19. I'm sure the city and everybody else willing to oblige and do that on this day of prayer. We'll get you back to Ellen right now. All the day's news coming up on the 411, including Erica tracking those storms that are coming in. We'll see you in about 20 minutes.
We could get one test, so I tested myself. It came back a week later